Welcome everyone to Virtual Executive Leadership Panel. My name is John Karsabai and I'm your guys' host and moderator today. Before we begin, I'd like to thank everyone for registering and spending time with us on a Friday afternoon. Moreover, I wanted to thank the entire ProSource IT team for working diligently to bring these great web series to you guys. As you would imagine, there's a lot of effort that goes on to bring these events live. So I just wanted to recognize that real quick. So thank you for that. As we were preparing for this panel, we've received quite a few questions from a lot of you guys who had registered. So there will be a Q&A session towards the end of this session. We'll try to reserve as much time as we can and address a lot of your guys' questions. So thank you for sending those over. And I'm personally very excited about this panel and looking forward to learning from our panelists today, very highly accomplished executives. So today we will hear from Chief Technology Officer of Broward Health, Jack King.
Hi, thanks John. Thanks for having me on.
And Chief Technology Officer of Amtrak, Sovan Shatpathy.
Hey John, and hello everybody. Thanks for joining.
Awesome, excellent. Well, without further ado, I'll jump right in. Sovan, I'm going to start with you. Can you give us a high-level overview about Amtrak, about what the company is all about, and what is your role and what falls under your purview within the organization?
Yeah, sure, John. So Amtrak is also known as the National Railroad Passenger Corporation. So it's essentially America's railroad, which connects 46 different states across the length and breadth of this country and also 3 Canadian provinces. Almost 50-year-old, it was incorporated in 1971, right? And we are headquartered out of Washington, D.C., right in the Capitol Hill area. I can see the dome of Capitol Hill from my office, actually. I would consider ourselves as an essential service, even in these kind of challenging times we are going through, because we connect towns and places where Amtrak is the only mode of connectivity. As it relates to my role as the CTO, I'm in the IT organization and I own the combined architecture, strategy, data, analytics, digital, and all the revenue booking and customer systems which bring in money for Amtrak and makes the customer experience good. Right? So that's the summary of my role.
Great. Thank you, Sovan. Jack, what about you? Can you just give us a little overview about Broward Health and your role?
Sure, absolutely. Thanks again for having me on. Broward Health is one of the 10 largest public hospital systems here in the United States. We serve the upper 2/3 of Broward County. We have 4 different hospitals and a children's hospital, multiple primary care centers, family health places, different clinics and home health services, educational programs. We offer a lot of screenings and are very integrated into our community. Our total number of beds is approximately 1,500. We're overseen by a board of commissioners that are appointed by the governor. And our primary role is to serve the needs of our communities that we live in. My role here as Chief Technology Officer encompasses much of what Sovan just talked about in terms of similarity, all the infrastructure, a good chunk of the data, programming, and database teams. And a lot of the IT service management pieces that we're going to talk about as it played a big role in COVID going forward. So thanks for the opportunity to be on, John.
That's awesome. Thank you, Jack. Broward Health is, I have it's a special place for me because my daughter was born there. So
great. Thank you.
Yes, a little insight there. Jack, so continuing on with you at Broward Health, your company is at the front lines fighting the pandemic. I'm curious, how is IT division of the company helping drive some of these initiatives? And what strategies have you implemented in order to not only prepare, but adapt to these times?
Yeah, thanks, John. I mean, we could dedicate a whole hour to that with the amount of work that's been done here, believe me, so I'll try to keep it concise. But first, I want to point out that it's an honor to come here and tell this story today because there's been so much great work that's gone on in the past handful of weeks to support those who are on the front lines. And the real heroes here are nurses, our doctors, those who are out there, risking their lives to take care of people who have unfortunately been plagued by the disease. So that being said, our IT support role became very critical early on, and we did it in many different ways. I kind of will bullet point some of them out, and we can go back and talk about a couple of them. But the primary role is connecting others, right, and keeping them safe. And early on, we were tasked with trying to figure out how quickly we could keep the interactions between those who we thought might be positive with the virus and their caregivers to a minimum, as much as minimum necessary, both to preserve exposure and PPE. So one of the first things that we started to enable were virtual visits and the ability to communicate via technology, which those of you who've been in the hospital before know that the audio ways of doing it are your traditional pillow speaker, right, and nurse call system. So we had to get very creative right out of the gate to be able to save on protective equipment and also save on numbers of exposures. So we spent a good deal of time spinning up different opportunities there using a couple of different tools. We were one of the first 5 hospitals in the country working with Microsoft with their Teams for virtual rounding tool. We worked closely with Cisco to also pilot some of the Jabber auto answer technologies. All of this was done from iPad to iPad, whether it was from the nurse's station or outside with any other type of iOS device. In addition to taking care of the inpatient exposures, we also had to support pop-up tent facilities on the outside of our emergency rooms. So much of what we had to do was respond in a very agile way, which, as you guys can imagine, bringing that infrastructure out of the building, using virtual infrastructures or cellular components that we hadn't used before. So we had to respond fairly quickly to go both outside of the building and to bring our stuff as far out as drive-through testing sites. So we had to go out to the community as we got further out and set those things up. So we were able to respond to expand our existing infrastructure, to offer some new and innovative platforms, and really continue to be data-driven to help take the data that we were collecting out there back and build dashboards so that we were helping folks understand how many tests were given out today, how many were coming back positive, where the zip codes were for that, and then working closely with state and other resources to report that information. So IT was very integral to being part of that front line, and we did it in a number of different ways. I mean, that probably represents a third of the things that I can tell you about that we did, but I'm really proud of the team and what we were able to accomplish.
Yeah, absolutely. And definitely thank you for sharing that. I would imagine, it was quite an undertaking to adapt to these times. And so, thank you guys for everything that you guys are doing. Sovan, from your standpoint, how has COVID impacted the operations within your organization, and how have you guys adapted? If you could provide any practical or any case study examples, would be interested in hearing a little bit more about that.
Yeah, it's a broad question, John, right? When you say operations, I presume you mean like our core business of running trains, right? Yep. So I would say that when, in March, April, like any other transportation provider, Amtrak was severely impacted by the pandemic, right? So almost 90% plus the ridership came down and otherwise. Having said that, like I mentioned, being an essential mode of transport, we still need to maintain a certain level of service across the length and breadth of the country. And almost 17,000 plus of our associates or employees are what we consider as frontline employees, right? Customer agents, people who work on trains, contact centers, mechanical people, engineering people. So, what we did was we basically adjusted to the situation, right? I mean, first of all, as things move for folks who can work safely from home, we mentioned that you can do so, and the kind of setup IT has allows us to be productive from anywhere. But for folks who are on the front line, you provide the right level of safety gear, you provide the right kind of guidelines, the cleanliness, the social distancing. And there is a whole incident response team, because Amtrak being a public sector, we are mandated to have an IRT, and that IRT has kicked into gear for almost 8 weeks now. So they are like the nerve center or the command center, which drives the entire decision-making framework across the corporation. And it has got representatives from all the groups, which helps, right? So at any given point in time, we know what's going on in the nook and corner of the country, including how many of our employees might be testing positive or who have recovered. What do we do to provide them help? How we have extended our leave plan so that we take care of them with a peace of mind if there is a recovery period, right? So this is more of like the past 2 months, John, right? And now as we are getting into like middle of May, what's going on at Amtrak is that now we're looking at like different scenario-based planning, right? In terms of what would the uptake look like. And for a country as big as US, there is no one size fits all, right? It will be different. It will be city to city, sometimes county to county, state to state, right? So essentially what is happening is we are doing scenario-based planning depending on how the demands would be, and then deciding. Like one thing which is all over news yesterday is that now Amtrak has made anyone traveling on the train to wear face mask as mandatory, right? What's the outer limit of it? I don't know, but I think it is a peace of mind for our customers and also for our employees. Secondly, we have told that for all of our trains, it's only 50% capacity, right? We have capability to kind of lock down the train. So let's say 300 people could go on the Acela, which is the high-speed train in the corridor from DC to New York and Boston. Only 50% of the train will be going, right? And then all the other things we will be putting into play, like thermal scan or right kind of sanitizers. But essentially, as you can say, it is a practical based plan where employee and customer safety is paramount. But at the same time, we have to plan to be on the other side, right? I mean, we can't just twiddle our thumbs and sit down. That's not how a transportation and hospitality company can work. So we have to plan for the other side. So things are moving on. But like I said, it's a scenario-based planning with the practicality of CDC guidelines, local state guidelines, local county guidelines, and then you kind of go from there. And I'll pause at this. Now the IRT is evolving into what's being called as a recovery and transformation effort. So another cross-functional group across Amtrak with the right executive and ground level representation who are planning everything from workforce, worksite, customer, product attributes, and how do you kind of operate in this new normal, whatever that might be, and we can't really predict at this point. I hope that answers your question a little bit.
Yeah, no, it definitely does. And I know there's a lot more to it, but definitely thank you for summarizing that for us.
Yeah.
Appreciate it. Amtrak is, it's not something that, you hear in the news a lot, but at the same time, it's such an integral part of the entire transportation in the US. So that's very insightful. Jack, I want to shift gears a little bit to talk more around talent acquisition and attracting the top talent. I personally know you guys employ one of the best professionals, especially in IT, because, we work a lot with you guys on that. So attracting the top talent during these interesting times, what strategies have worked well for you with so much, so many candidates available? How do you guys continue sending that right message that Broward Health is one of the best places to work for?
Oh, thanks, John. I think that the candidates that we now have access to that we didn't before the crisis create a great opportunity, right? Our ability to market the type of work that we do and try to find and attract mission-driven folks who want to be part of what we're doing to serve the community is really important. So continuing to highlight in social media with our marketing folks the great job that Broward Health is doing, continuing to work closely with our talent acquisition group. We have one of the best folks, Eileen, that I work with quite regularly, and she and her team are fantastic at working with others to help us identify and source individuals. So we kind of have the traditional pipelines that we've been looking at, and you're right, there's different types of volume that come in, and being able to look at, frankly, the quality of some of the resumes has gone up dramatically for the positions because folks are now freed up, right? They otherwise weren't looking, or all of a sudden were furloughed, or unfortunately were laid off. So we've got to quickly be able to go through those. While we're still doing that in a somewhat manual way, I'd like to be using more AI to go through and make sure that we're sourcing those folks faster, because there's so many more people in the funnel, if you will. Having access to them has been great. Working through those traditional channels, using the tools like Zoom, Skype, WebEx, Microsoft Teams, all the above, right? To be able to have these types of interactions with candidates where we can have the rapport and get to know more about them and talk through their resume is important. In any downturn in a market like this, we talk about, these crises offer opportunities. And sometimes it's working with folks who are vendors, some of the manufacturing vendors, some of the resource and talent folks like yourselves. Other folks have access to knowing all of a sudden these new resources that are in a given market. So us staying close to those folks, taking warm referrals and handoffs is always helpful as well, because all of a sudden folks who understand what your need is because they've been talking with you all of a sudden have access to talent they didn't as well. So we've just been trying to stay close with everybody and working even with the associations and others. I think everyone wants to see employment back at full capacity as fast as possible, right? And with what makes sense. But to what Sovan said, a lot of the needs and skills that might have been at the top of my list before the pandemic are slightly different now, because to Sovan's point, in healthcare, we weren't as used to the remote worker pieces that are out there. So now all of a sudden, one of the pieces that I didn't talk about that IT enabled was all of that remote workforce, because I wanted to work it into this part of the conversation. So, being able to scale our virtual environments and being able to make sure that people have the tools that they need at home, which they weren't used to having to do before, has opened up a whole new skill set that we're looking to scale more quickly. So we're still looking for that talent. We're sourcing it through the traditional channels. We're trying to make sure that people are connecting with the mission and that we're pulling those in and looking at them as quickly as we can. So.
That's great. Thank you for sharing that, Jack. Sovan, from your standpoint, operational resilience has been, getting a lot of attention lately, especially during these times. How has that helped your organization continue the delivery of key business services to your clients during these times?
When you say operational resiliency, you're referring to technology resiliency or broadly operational resiliency across the company's line of business? Because they can be two different answers.
No, I'm more interested on the technology side, mainly because that falls under, your functional area and you as a CTO. I'm just curious to hear some of the, practical examples, how that has, contributed to that.
So a couple of things, John, right? It's almost like we have been preparing for this all our lives, right? I mean, and sometimes you get tested, it's almost like courage in face of adversity, but it better work. First and foremost, all of our mission critical systems, other than our mainframes, just to go a little bit technical, runs in cloud, runs in public cloud or in large private cloud. So what that essentially means that there's availability and elasticity and DR, they're all kind of built in, which has helped us a lot when it comes to our back office, front office systems and all of that. Second thing which has helped is that I hinted at it. We have a massively unionized workforce, tens of thousands actually, and they don't have like an average IT or management employee, a laptop, an Office 365 account and all. Most of them just have a personal handheld device of their choice. So we have been working for quite a while to ensure that the key set of applications which are required for a yard worker in Oakland, California, like timekeeping, like the payroll, labor management functions, stuff like that for a blue-collar worker is accessible in the Android or iPhone or a tablet, right? So ubiquitous mobility has been built in for a while now, which also kind of ties out to our single sign-on strategy. So between the pervasive nature of almost 90% of our workload running on cloud, and the fact that the massive agreement workforce of Amtrak is more or less enabled through a mobile form factor, we had the basics in place, right? And the third leg of the puzzle is all the people who are working from home and how they work. And one interesting data point, we have all the usual suspects, right? Office 365, Teams, and Skype, and XYZ, but what I may want to highlight, John, and from a resiliency standpoint is the way we have built our systems is vast majority of them, you can go from any device, anywhere, anytime, actually, to be honest. Your email, your Teams, your procurement systems are like Ariba on demand and cloud. Our HR systems is on SuccessFactors. Everything is in cloud. So you don't really need like a corporate VPN. You don't need to be tethered to your work laptop to do your job. So one metric, for the IT audience, we have been looking very carefully is my VPN, toppling over. At any given point in time, for a company of almost 20,000 employees, there are not more than 1,000 to 1,200 people who are going into the corporate VPN. Right. Because you need to go into only corporate VPN if you need access to something super secure, right? Everything else is also secure, but if I can do my job from my personal Mac, through which I'm talking to all of you right now, that works out great, right? So I think all of those, that ubiquitous mobility, the cloud first, and a strategy of any device, any place, any time, which we have been working on last 2-3 years, have helped us today, actually, John, both in our front office and in our back office, right? I hope that answers.
Yeah, that's great. Thank you for providing those examples. Definitely makes sense. Um, Jack, from your standpoint, with so many companies going through furloughs, downsizing, you briefly touched upon that in your previous response. As an executive, how do you ensure proper, staff motivation and productivity? Your company continues at the same levels.
Yeah.
Anything specific that you can share with us that has worked well or maybe has not, as a lesson learned, would be great.
Sure. No, thanks, John. I think now more than ever, it's important to really lead with empathy, right? Have frequent and consistent communications that are personal, where people have a chance to tell you what's on their mind, right? There's a lot of anxiety and fear right now because of the unknown. I think it's driving that for all of us. So giving people a chance to express that or acknowledge that, even if we don't yet know the answer of what that means, at least allows people to get it out on the table. In some cases, I mean, we don't have as large of an organization as Sovan, but with 8,000 plus employees, we have quite a few folks who have been impacted by this in different ways as well, right? So I think the first thing is people's basic needs. Are they safe? Are they okay? Are their families okay? And seeing whatever they need to have done to make sure that they're cared for, right? So addressing those things at a basic level is the tantamount. Helping understand what type of work environment challenges people have that they either left at the office or not, they might be struggling with to get through their day as a remote worker is the other part of that. Because deep down, everybody wants to be productive, everybody wants to be able to lend a hand. But if they don't have access to some of those tool sets, we need to make sure that we get it for them quickly. We've been in good shape as far as being able to produce the virtual desktops and create that experience like Sovan was talking about, the anytime, anywhere. But a lot of it in our particular cases are getting people used to it, right? It's education, it's making sure that there's a comfort level with the tools and the other pieces. So again, frequent communications, we have our executive team and senior executive team has been outstanding. Our CEO, Gino Santorio, our chief medical officer, Dr. Ta, administrative officer, Alan Goldsmith, and others, they have led through great examples of communicating at daily huddles. So those daily huddles happen real early in the morning. There are subsequent huddles that happen at departmental levels so the information can flow. So I think having that frequent communication, even if in some cases it's no update or here's what we know today, or it was just an update on a dashboard or what was happening with drive-through testing or what might be happening in the community, creating that forum was a great opportunity for them to log in. Before the pandemic hit, we had a daily operations call just to get people in sync. And we, out of a department of a little less than 200, we might have 60, 70 people on there. Boy, during the pandemic, you would see that shoot all the way up to double to triple that, right? We were getting really close to 100% participation. So people were hungry for the communication. You give them a platform, and then you also help them be realistic, because from the IT folks' perspective, they're also supporting clinical and remote users as well. And we're helping people reconcile kind of the promise and the reality of technology, right? Not everybody understood what the WebEx platform did, and the fact that no matter which platform, the one we're on now or any of them, a lot of the dependencies on the overall satisfaction and quality of the experience is that last mile, which is really controlled by the ISP or however you're accessing it, right? So being able to help them address their customers' needs as well and bubble those things to the top has been helpful. So really letting people have their voice, highlighting random acts of kindness. And I have to tell you that one of the things that I got the most feedback on that seemed to cause people to pause and reflect and feel better about what was going on was knowing that they were making a difference. As an example, we rolled out iPads with FaceTime. It was actually featured on Miami News, where we were able to put people in touch with their loved ones who were at the end of their life. And it was one thing to talk with them on a telephone, but it was another thing to look them in the eye, on a device. And I had an employee who called me in the morning and was pretty emotional about what he had done the day before, which was he set up a meeting for someone who was an international person to say goodbye to someone overseas using WhatsApp on a device. And knowing that they were part of making a difference in that person's life really connected them to why and drove them forward and really boosted morale. So that's one example that will stick with me forever that I'm happy to share.
Well, that's great. Thank you for those examples. I'm pretty sure that definitely that sense of purpose definitely contributes to continuing that motivation levels, especially during these times. So I'd like to hear your input on the same exact topic. How do you deal with, driving and boosting the employee morale and the motivation within the organization?
Yeah, I think, John, these are interesting times. And like Jack was saying, right, it's almost like Maslow's hierarchy of needs, right? Whenever you talk to your employees, the first thing we always, if people shelter, home, and safety is well-being is in question, everything else is a moot point, right? At that point, and that's what the hierarchy of needs talks about, in business books long back. So the very basic things which we preach is what we practice, right? When we get into meetings or when I talk to my folks, it's something as practical as that. How is your day going? Are you staying safe and healthy? And what can I do to help you? You see what I'm saying? So it is so people know at different levels of the organization that we care. I mean, I also feel the sense from my boss and that okay, I mean people are understanding of the unique circumstances we are working in with, people are stuck with kids at home, there are single moms, there are working dads, there are old age parents at home, some people are going through the trauma, many are recovering on the positive side, right? I mean, so those are things which, I mean, keeps us grounded. I mean, beyond that, it essentially comes down to tying the folks to the mission of the company. Amtrak has a different kind of mission, but it's still connectivity. We moved like 33 million people last year, right? I mean, it moves more people in Northeast Corridor than all the major airlines combined.
Wow.
So you kind of, yeah, I mean, 750,000 per day until February last week, right? It's a lot of people, actually. In fact, the Northeast Corridor does almost a couple of $1 billion of business, actually, and all the numbers are out there. It's a public sector, but Amtrak publishes everything every quarter and every year. So then you tie it back to the fact that there is a need for connectivity because Amtrak has also been helping people in moving essential supplies and all of that. And then, I mean, ultimately for us, a functional transportation system which is safe and secure based on some of the facets I highlighted before is essential to also to get the country moving, if you think about it, right? The eastern seaboard of our nation is probably half of the country's GDP, if you think about it, all the 8 or 9 states. And it's literally called the Acela corridor because of the number of people who take like the high-speed trains, all the business travelers. So it's very important that even as epicenter of the world became New York, and even if there are other hotbeds in Massachusetts or even in DC metro area, even I constantly keep saying that we have a once in a lifetime health emergency. There are things we can do, there are things which are out of our control. We'll get on the other side of it. But at the same time, we owe it back to the people, ourselves, and the nation that we help on the economic recovery, right? It's no fun to read that 15% is the unemployment rate and 33 million have filed debt, and all those numbers are not mere statistic, right? In a service economy like US, which is so much consumer sentiment driven, it is important that we inspire people, especially who work at Amtrak, to say that your job is also to get us to the other side so that the uptake, even if it's slow, as the new normal comes and things happen, vaccine will come, treatment plans will come. We are in a point in time, but you got to help. We can't just sit here and say that it won't happen. So, and I'll pause at this, Acela being our premier product, right? The high-speed trains on the corridor were paused completely till end of May. But now starting June 1st, we are starting it back again at the 50% capacity with the mask compulsory, with all the social distancing guidelines built in and ultra cleanliness built in, because it is important to move the economy back at the end of the day, or even to ensure that there is transportation of people when required from a healthcare standpoint. Everybody can't be driving all the time. So, and when you kind of tied all that, John, people get back to the mission. And once you have them tied to that, I think it becomes so much more easier to kind of row in the same direction, if you think about it, right? That's, by the way, true in any company. Why Amtrak?
Mm-hmm. Right. No, absolutely. And thank you, both of you, for providing those insights and leadership perspective, because I'm pretty sure it's not easy. You always hear some of the basic things that everyone is trying to do, but when it comes to action, I'm pretty sure there's also, different perspectives on how people perceive that. Jack, there are a lot of topics on leadership through crisis, especially during these times, but not too much emphasis on personal productivity strategies. What has helped you personally to stay productive? And I'm also curious, let's say as an example, you have a one-on-one with one of your direct reports. What are some of the recommendations that you provide to them? How do you stay productive? How do you stay motivated during the day, especially when you're working remote with a lot of that uncertainty surrounding us? Jack, you're on mute.
Sorry, thank you. That's important to understand because especially for myself and most of my direct reports, our relationships were driven much more by face-to-face than the virtual relationships before the crisis. So it's really helping myself and them focus on what's important. And quite frankly, during a time of crisis, helping others understand the difference between urgent and important and urgent and unimportant, right? I think from the old Covin grid, now more than ever, your ability to put things through that lens to say, wait a minute, that sounds urgent, but how many other things could or should we be doing? And helping others resist the urge to do something to feel like they're contributing versus stepping back for a second and thinking about doing the right thing. And I think being more thoughtful, asking more questions on my part, making sure that when we do touch base, we do it, we have a brief huddle in the morning, as I mentioned before, excuse me, primarily to talk about operational, items, changes for the day, different things that are just, kind of housekeeping things from running of IT. But when you look at those next steps around productivity and projects, a lot of what we've needed to do is look at the tools that we had, including ServiceNow, Microsoft Teams, and others, and start to reconcile, because we had long lists of things that had been planned before the pandemic hit. That list got jumbled around relatively quickly, and then getting folks to focus on what truly was urgent and important, we've been migrating to other tools. We really have found Teams to be very helpful in keeping the single pane of glass and collaboration platform for everybody in the same spot, pulling it together. So that has kind of been one of the platforms that has come shining through here that I've used a lot more of, both to pull people together, to do the communication, and to keep people focused, because there's a lot of noise out there. So keeping our leaders focused on what the signal is, even though that signal may change from day to day, at least making sure they know what they need to do that day. I think they feel a lot more confident with that level of direction. Myself, knowing that we're using those tools and using that as kind of my GPS for what's going on for the day is always a great start. By noon or by 3 o'clock, my phone may ring, or I may get 3 more text messages that change it around because of circumstances. But at least knowing that we're planning, using different tools, and collaborating differently, that's helped me out a lot to stay on top of everything.
Very good. Thank you for sharing that, Jack. Sovan, from standpoint of preparing yourself and the organization for the next period, for what's to come, given there's so much uncertainty, I'm curious, what strategic initiatives do you have in place to ensure continuity and company growth from that standpoint?
I think I started to talk about it, John, in the recovery and transformation cross-functional team, which has been built up, right? So there are the most obvious things around what does the future workforce look like, right? Because we also feel that there is some things which may become a continuing normal rather than just an interim new normal. What does the future work site look like? And then most importantly, what does the product attribute look like? By product, we mean actually the train and the experience and everything else, including the stations, right? So we are in early planning stages of it, but there is a deliberate approach to it, John, based on the scenario-based planning and how things may uptake in terms of economy, which in turn translates to customers, people's willingness to travel. And it's all about, everybody has different comfort zones, and it all depends on where you live also to some extent in an environment like today. But one of our main focus obviously is that we want to go contactless as much as possible. We were already on that path. Currently you can't buy an Amtrak ticket by paying cash anywhere. Actually, you have to be contactless. Inside of the train, the experience was more or less contactless. It will go even more, in terms of how you scan tickets, how you kind of assign seats. And then we are debating through things like pre-health questionnaire. What should we do in terms of providing even more information at fingertip, because the whole idea from a customer perspective, John, is this, right? If I boil it down, in today's Uber connected world, if I can provide you all the information you require to go from your home in Miami to a location wherever XYZ in a seamless and frictionless manner where you don't have to literally talk to anyone, all the information is coming to you in a mobile form factor. That is it. No, that's the holy grail, because then you don't have to talk, you don't have to deal with everyone, and you are essentially moving ahead. Now, there is the physical aspect of safety from a product standpoint, which is where the big stations like New York Penn, Washington Union, Chicago, these are very busy stations on a normal day. There will be strict social distancing guidelines. There will be until things kind of come to a normal and from a health emergency standpoint, right? So there is a physical aspect to it, but as far as possible, the core of it is that can I provide your entire travel experience on a platter in your mobile form factor so that you can travel without having to be bothered about anything else. And everything around you, which can make your travel a safe experience, is being done. If a 300 capacity train only goes with 150, right there you got actually massive distancing. And the cleanliness regimens and everything else will be posted so that you have both explicit and implicit assurances to people, including employees actually, that it is a safe environment to work, it's a safe environment to travel. And for whatever it's worth, it's not just because I'm in a train company right now in my career. The fact of the matter is a carbon neutral mode like Amtrak and trains have much more space. Let's be honest, these are big trains, wide bodied seats, compared to being stuck in the cabin of a plane. So there is a theory that, as people come back up, other than driving their own cars, trains will follow right after. It just makes practical common sense, right? And people will fly, we will all fly, but it will start from what's essential and then where we get to leisure travel and all. That may be a little bit out.
Absolutely, absolutely. Jack, from your perspective, when it comes to interviewing and hiring remotely, aside from the use of traditional tools like the Zoom video conferencing and all of those, I'm curious from practical recommendations perspective, what can you share that has proven to be effective for you and your teams at Broward Health to be able to interview and hire someone remotely?
Yeah, the old adage, I think, used to be outside of these tools, having that initial telephone screen, talking to someone, kind of letting them walk you through their background, getting a feel for their personality and how they may or may not be a fit with the team, whether or not their skill set was a match, that sort of thing. Taking it to the next level and using more of these tools, which is what we need to do versus face-to-face, we're still continuing to do that. I think from our side of interviewing and making sure that we have the right environment to do that, coaching and teaching people to make sure that they get set up early and they test right in terms of doing these things, but that they have their cameras on, that they have the kind of distance like we do right now where we can see into each other's eyes and facial expressions, because I think it's the visuals and nonverbals when we're going through that process that create a lot of that connection as to whether or not you're hearing what I'm saying or you're reflecting back to me actively that you're listening, right? So I try to make sure that we are creating the right environments for that. In our in-house environment, we had some very nice video setups that were in our rooms, very elaborate setups. So going from those really HD experiences with a candidate where, 6 of us were around a table, and we're not around a table like that anymore because of social distancing, to sort of this new norm with people with hopefully an HD webcam, a good connection, and being able to broker that conversation is important. I think that the whole orchestration of conversations when we move into a virtual platform is important, right? The fact that you're moderating today, John, and that Sovan and I each are taking turns in answering this, it creates a nice cadence and flow. What I've noticed is whether or not it's the folks on our team interviewing folks, or in some cases, someone who's interviewing who hasn't participated in this type of a forum, if you have someone who's nervous and who's talking very quickly or doesn't see the cues that we're ready for the next question, it can sometimes make for an awkward interview, right? In terms of stopping and starting. So making sure that on our side, we're talking to people up front about what the format's going to be, at a high level. We'd like to hear about you for a few minutes, then we'll ask you questions, we'll go back and forth. Sets the expectations that hopefully when you've got all the other, I's dotted and T's crossed in terms of the lighting, the volume, the level of the camera, those sorts of things that, we take for granted, right? And for those of us who've used it for a long time, but for some candidates and for some folks who are interviewing folks, they're not used to it, right? So it's just a lot of reminding, and then upfront, to the degree that we can get those candidates ready maybe a little bit differently by giving them a tip sheet. Make sure that you're in a room that's quiet, make sure that you're in the right location. I know it sounds, maybe a bit elementary, but I think that people benefit on both sides when they're able to get, that's something good I need to remember. My dog barks every time the UPS person comes, et cetera. You don't want to hear flushing toilets in the background. So, the one thing that I'll say jokingly that jumps out at me a lot more if I'd see it on a resume would be the ability to work the mute button appropriately. So that's all I have there.
That's great. Thank you for providing those recommendations. Real quick, I want to ask Sovan, from your standpoint, have you made any significant changes to your interviewing hiring strategies during these times?
Some, in the sense that we cannot really meet people physically, but we are still hiring and bringing people on board, shipping them laptops to their home, actually, which is all configured to go and start. But at the end of the day, I think the one quick pivot, at least I have done personally, is instead of kind of going through a telephonic screen, which would be like a standard de rigueur or norm until now, we just switch to like Teams or Skype video from get-go, because many times, depending on the people you're talking to, like Jack was saying, it's almost like, from my perspective, what's not being said is even more important than what's being said, right? And there are certain intangibles you cannot get from a resume or a phone, like how much of passion he or she is bringing to the role, what's driving them, what's their motivators, and things like that, right? So beyond that, it has essentially been like virtual roundtable. We would have had like panel interviews and all of that in office, but we have switched pretty much seamlessly to Teams, actually, for all of that. And then when it comes to onboarding people, like I said, you make an offer, and we have actually multiple folks who have started, who have not visited an Amtrak campus yet. They will hopefully soon. But the good thing is it's more or less worked out for them, right? So not a massive change, but go very quickly into the intangibles instead of going through the phone game. It doesn't make sense in current environment. That's a fundamental shift from get-go.
Yeah, very interesting. And for us specifically at ProSource, as we help, companies like yours guys with finding the right talent and prepping them for the interviews, definitely had, prompted us to adjust a lot of the strategies we have, preparing those candidates for, the adapted processes through these interviews. So that's very interesting to hear your guys' perspective from the executive standpoint. We're running kind of short on time, so I'm just going to skip the last few questions that we initially planned, and I'll open up the floor to all of the questions from the audience. While people are submitting questions, there is one that came in, is how has COVID-19 changed your team's initiatives and priorities? And how do you decide where to focus your energy? Do you have any specific examples? Jack, if you don't mind taking that one.
Yeah, I will take that one. I think the priorities have now become how do we help fight the pandemic? So in terms of supporting the caregivers and their unique needs, we talked about virtual rounding in terms of keeping people from the inpatient perspective apart from the patient where they can be. We've also enabled, as you guys can imagine, folks aren't, we're trying to get that patient demand back to come into the office, but being able to offer the virtual video visits and using technology to be able to do those things. So things that had been maybe a year or two out are now moved a lot closer up, right, in terms of supporting this. So we've basically accelerated the use of any of these platforms that bring the patient closer to us. And I think Sovan said it earlier, the journey that we've been on to support both our employees and our patients is changing. And we have to look at our portfolio of projects and reorder them in that. So we want to make sure that we're given a safe patient experience, that we're able to meet them where they're at, which means using technology to get to them. And in the long run, I think that's what's really going to flatten the cost curve and give us more access for everybody for healthcare. So before the pandemic, if I would have asked the average physician what they thought about telemedicine, I wouldn't even get a response back, right? So since the pandemic has hit, our phones are ringing off the hook and everybody's ready, to start going in that direction. So for me, it's really increased the need to move anything forward that has to do with communications and collaborations with our patients or each other.
Great. Thank you, Jack. Sovan, there's a question for you. What is the process for your IT team to get devices ready for remote new hires? And how do you get them onboarded quickly? You're on mute.
I'm on mute. Jack won't like me now. I didn't work for me.
No, I did it first, Sovan. You're good.
No chance in Broward Health not to get a job. No, so to answer, John, I'll answer it at a certain level because I'm not exactly involved in the day-to-day process. But fact of the matter is, when it comes to provisioning of like the device of your choice, whether it's a Mac or a Windows, we have a desktop engineering team, which has got standard images. Like Windows 10 is already our standard here. We have birthright access in terms of a certain set of tools everyone needs to have access to. So essentially, it comes down to working with like the field support and the desktop engineering team to kind of load the image based on the profile of the person, right? And more importantly, kind of getting them squared away from an identity and access standpoint, because everybody at Amtrak has a unique identifier in terms of the employee ID, which is in our backhouse SAP ERP, right? And that drives everything. So that needs to be right. The email needs to be set right because it's an Office 365 ecosystem, right? That in turn kind of says that, okay, I'm hiring a principal engineer, or I'm hiring a manager, or I'm hiring a director. So depending on the role and the function, the birthright access kicks in, which means that certain predetermined tools get applied to the role. And beyond that, so that became a standard image, right? And beyond that, once the person has the device, they can always go back to service desk or to go through the normal process to get access which is above and beyond a certain tool which is not standard. For example, Adobe Creative or MS Visio may not be standard for everyone, but someone may require it because they are a creative professional. We can provision it, but then you go through the normal ticketing system, and we run on ServiceNow. So you can actually go again from any device and put in your stuff and you go from there, right? So it is a fairly seamless process. And the same thing also applies to the cell phone in terms of, we offer both Android and iPhone, right? And then depending on the kind of role we provision the device, right? And then we manage the device from what's Microsoft Intune, which is what is used for device management and access management. Right?
Great.
So, and those are like the high-level steps, John, right?
Yeah, absolutely. Jack, I'll let you take the next one. Are you expecting a phase 3 to be back to normal, or will this change our tech delivery paradigm forever?
My crystal ball is a little bit broken and fuzzy on this one, but I do appreciate the question because I think that we're all trying to look forward and to be prepared and agile in our response. I would like to think that things will return to normal sooner rather than later, but I don't have the data to prove that, right? So from my standpoint, I think we need to be prepared for some things to start to return to normal as we have the right signals that we're safe and that it's safer to come back together, to do more things in person. But there are other factors and ways of doing business. I think Sovan had pointed out before, some of the kind of unintended consequences that came out of this pandemic, I think are going to change behavior for a long time. I think people's need to feel that they have to drive into the office to get certain things done, spend time on the roadway, pollute things, do other stuff, pay tolls. I think human behavior will be changed in the long term. The practice of medicine with regards to how we do it, in talking with the clinicians that I know, I think that you'll still want to have a hands-on assessment, right? And you're not going to want to have a telemedicine visit if you have chest pains. By all means, you're going to go to an emergency room, right? So your level of acuity will still drive some of the traditional services that are there. But I also think that if you happen to be a patient that is your condition is being overseen, you're a managed diabetic, you're someone with hypertension, someone who still needs the visit with your physician, that paradigm, I believe, will shift for the long term, depending upon how government reimbursements work, but the technology will follow that, and it's enabled those regular visits. So if I went and got my blood drawn, I was able to talk about my results with the doctor without having to drive into the office, right? those types of things I think are hopefully going to change for the better, because in the long run, it's a better use of the physician's time, it's a better use of my time, and quite frankly, it's a better use of all of our collective resources. So I think it's going to be a hybrid.
Great. Thank you, Jack. Sovan, this one is for you. While the whole COVID situation has been unfortunate, do you see this as an opportunity to increase routes and ridership for Amtrak across US as a future strategic direction for the company?
Yeah, absolutely. Because like I mentioned, as we go back on the recovery path, I can only role play as myself. I'm also a customer. It's human behavior, I think, from your own home to the car. When you look at like a spaced out product like train, which is carbon neutral, the comfort level is higher than being jammed into like a plane in a long distance 12-hour flight to Tokyo, maybe from DC. So there are some inherent advantages, even as we are kind of coming back to play. So those are all being factored in. There is a lot of investments actually in Amtrak. Pre-COVID, nothing is stopping. The whole SLR train sets are being refreshed. It was a $3 billion investment in 2014. So 28 new train sets starting May of next year is being introduced. A train set is like 9 cars, right? So it can take like 360, 370 people. We are on the market now to replace all of our state-supported business, which is essentially all the trains across the length and breadth of the country. And that will be a massive deal because we're talking about 75 to 150 train sets. And I will let you guys extrapolate. If 28 train sets in 2014 was $3 billion, what would be the cost, right? So there is a once-in-generation kind of fleet refresh which is going on, because we don't change trains like cars. They change maybe once in 30, 40 years, which also means we are getting a lot of excess capacity. And our marketing and revenue group is actively working to see how we tackle that excess capacity by moving more people onto trains as a desirable mode, like you would see in Western Europe or in Southeast Asia or Japan or China. Millions of people travel in trains as the first preferred mode of transport. And we can do that in US across the corridors. May not be across the entire country, but there are tons of dense city pairs in the US, which is where Amtrak will start to focus also going forward, right?
Great, thank you. Jack, next one is for you. How does an organization shift its focus on telehealth now that it's more mainstream and move from a legacy point of view to one of the technology, and actually a lot more companies adapting that?
Yeah, that's a great question, because I think a lot of us have now been pushed to the forefront of what are the best use cases, how do we identify those areas that will benefit the greatest, which of our patient populations will be able to use the technology easily, and how do we create that experience, right? So I think that fundamentally the time has arrived, right? Telehealth has been pushed to the forefront. The opportunity for us to identify which of our patients are going to benefit the most from this is there. We already know that it is in the example that I was talking about before, being able to access a patient who otherwise might have been hard to get to before. A lot of the social determinants of health that we've been trying to address has been accessibility, right? Folks who have to catch a bus or have to come into the doctor through other means than driving or having a reliable form of transportation might not be as likely to come in. So I think that I see us focusing on probably the most vulnerable and the most acute. We have a Children's Diagnostic Treatment Center, and they're very excited about telemedicine and what they can do in those arenas. So in the community outreach and to those who are perhaps the most vulnerable, I see that as a great opportunity. In the traditional, outpatient perspective, again, I'm not a clinician. We work closely with them. There will be opportunities dependent upon their practice and the patients that they serve to identify those that will benefit the most quickly from that, right? So if it's people like I talked about before that are trying to manage a condition or that can benefit from that frequent contact, then we can have either a care coordinator or a physician be able to get in touch with them more often. A lot of this is going to be driven, right now there's some temporary things in place that have changed reimbursement models, et cetera. Traditionally in the past, both that reimbursement from the government side as well as the major insurers drove a lot of that behavior. So I think the real unknown that we have here is I think the genie's out of the bottle with telemedicine. I think there's a great use case for us to continue, and we'll continue to see it there. But to what degree and in which areas is going to be quite variable. But I certainly think that there's a lot of great use cases like we just talked about that are going to continue to happen.
That's great. Thanks so much, Jack, for providing that insight. Unfortunately, we're out of time. There's quite a few more questions that we'll try to get those addressed as a follow-up to the webinar. Thank you guys so much, Jack, Sovan, for all of your insights, for your time to spend with us today. We really appreciate it. And to all of the participants, thank you guys for participating. The great questions, and we looking forward to our next webinar. There's one coming up on May 19th. So just follow us on LinkedIn, and you guys will be able to register and see a full list of all the webinars we have coming up. Thank you guys so much. I really appreciate it.
Thanks, John. Thanks so much.
Thank you.
Bye-bye.
Bye.